"You're awake," my wife said, as I opened my eyes after heart surgery. She wasn't relieved. She was surprised. They had already transferred $2.4 million while I was unconscious. What they didn't know was that the hospital's AI ethics system had recorded everything. My name is Richard Bennett. I'm 58 years old. I worked as an investment banker in Chicago for over 30 years. High-stress work, international travel, airport food, hotel beds, the works. You know how it goes. You push and push and push until one day your body just stops cooperating. That's what happened to me. My heart finally decided enough was enough. Severe coronary artery disease, 4 blocked arteries. The doctor said I needed quadruple bypass surgery. Immediately. When you're facing something like that, you want the best. And in the Midwest, that was Dr. Maxwell Chen. Everyone said so. The best cardiothoracic surgeon in 5 states. People flew in just to have him operate on them. The miracle worker, they called him, saved cases other doctors wouldn't touch. During our consultations, he was professional, confident. He had this way of looking at you, you know, like he knew exactly what was happening inside your chest, like he could see through skin and bone. "We'll get you through this, Richard," he told me. Just like that, matter of fact. And I believed him. My wife, Diana. She was there for everything, 15 years younger than me, still beautiful at 43. We'd been married 12 years. She went to every appointment, took notes, asked questions about recovery time, about medications, about what I would need at home afterward. The night before surgery, I remember looking at her across our bedroom and thinking how lucky I was. "I don't know what I'd do without you," I told her. She smiled, came over, kissed my forehead. "Antur, just focus on getting better," she said. I had no reason not to trust her. She'd been my anchor through market crashes, through career changes, through my daughter's wedding from my first marriage. Now she was going to get me through this. That's what I thought, anyway. The surgery was scheduled for 7 hours. It took 12. Complications, they said later. My heart wasn't responding well. My chances dropped below 30% at one point. That's what one of the nurses told me afterward. I flatlined twice. Dr. Chen kept working, kept me alive. That's what everyone said happened. When I finally came to in intensive care, something was off. Diana was there, standing by the bed, but her face, when she saw my eyes open, it wasn't relief. It was shock. "You're awake," she said, like it was a question, like it was the wrong answer. I tried to speak but couldn't. Tube in my throat, but I could see. And what I saw was Dr. Chen standing in the doorway behind her. He had the same expression, surprise, almost disappointment. I was too out of it to really process what that meant. Pain medication, anesthesia still in my system. You rationalize things, you know? Tell yourself you're imagining things, that the drugs are making you paranoid. But during my 2-week hospital stay, I started noticing things. The way they'd stop talking when I opened my eyes. How they'd exchange glances when they thought I wasn't looking. A familiarity between them that seemed inappropriate. The way his hand would linger on her shoulder. How she'd lean closer than necessary when he was explaining something. Small things, things you could dismiss individually. But together they formed a pattern. Still, I didn't say anything, didn't confront them. I was focused on just breathing, on not dying, on getting strong enough to go home. I'm a numbers guy, always have been. That's how I made my living for 3 decades, understanding the movement of money, the flow of it, how it works, where it goes. But Diana had always handled our personal finances. She was good at it, organized. I trusted her. After I got home from the hospital, I was weak. Could barely walk to the bathroom without help, but my mind was clearing, and something kept nagging at me. Something wasn't right. So one morning, when Diana was out running errands, I logged into our accounts, just to check, just to ease my mind. That's when I found it. Our retirement accounts had been emptied, all of them, $2.4 million, transferred to new accounts under her name only. The transfers had been initiated 3 hours after my surgery began, when I was unconscious, when they were counting on me not surviving. I sat there looking at the screen for a long time, not moving, not reacting, just processing the information. Then I started digging deeper: credit card statements, email accounts, travel sites, found the one-way tickets to Grand Cayman, first class, 2 of them, Diana and Dr. Chen, scheduled for 3 days after my original expected discharge date from the hospital. If all had gone according to their plan, hotel reservations, rental car, everything set up and ready to go. They were planning to run away together. With my money, while I was dead on an operating table, most people would confront their spouse, yell, scream, throw things, call a lawyer immediately, but I didn't do any of that. I just shut down the computer, cleared the browser history, and waited. Diana came home with groceries, asked how I was feeling, if I needed anything, acting like a concerned wife, and I let her. "Fine," I said, "just tired." She nodded, patted my hand, went to make lunch. And I watched her, really watched her now. The nervous energy, the way she checked her phone constantly, the quiet conversations she'd have outside on the patio, thinking I couldn't hear. I didn't confront her, didn't let on that I knew anything. I focused on my physical recovery instead, started walking around the block, built up my strength, took my medications religiously. But I was also thinking, planning, because there was something they didn't know, something they couldn't have anticipated. 3 months before my surgery, the hospital had implemented a new ethics compliance system, automated, AI-driven, something about reducing liability, preventing malpractice. I remembered reading about it in the hospital newsletter while waiting for an appointment. What the system did was flag unusual patterns in medical staff behavior, communications, interactions with patients and their families, all to ensure proper professional boundaries were maintained. And what Dr. Chen and Diana didn't realize was that everything, every text, every conversation in the hospital corridors, every lingering touch, all of it was being logged, analyzed, flagged. Patterns don't emerge overnight. Systems take time to analyze data, to establish baselines, to identify outliers. So I waited, kept my routine, took my medications, went to follow-up appointments with other doctors, not with Dr. Chen. I claimed scheduling conflicts, preferred the hospital's cardiac rehab team. Nothing suspicious. Diana became increasingly distracted, nervous. The money was transferred, but she couldn't access it yet. There were holds, security protocols, things she hadn't anticipated because she wasn't the financial expert in our marriage. I was. What she didn't know was that certain transactions that large automatically trigger reviews, especially from accounts that had previously shown no history of such behavior, especially when the primary account holder was hospitalized at the time of the transfer. Dr. Chen started calling the house more often, checking on my recovery, but I could hear the tension in his voice, the barely concealed impatience. Once, I picked up Diana's phone when she was in the shower. A text from him. How much longer? Not, how is he doing? Not, is his recovery on track? Just, how much longer? I put the phone back exactly where it was. Said nothing, but I knew the hospital's system was working, collecting data, making connections, building a case that I would never have to present myself. 6 weeks after my surgery, Diana started making excuses to leave the house. Long shopping trips, visits to friends I'd never heard of, a sudden interest in yoga classes. I didn't challenge her, didn't follow her. I knew where she was going, who she was meeting. Meanwhile, I received a call from the hospital's compliance office. Just a routine follow-up, they said. Standard procedure for complex cases. They asked about my care, about my interactions with the medical staff. Very professional, very thorough. I answered truthfully but minimally. Didn't volunteer any suspicions. Let them connect their own dots. A week later, Diana came home agitated. Dr. Chen had been called in for a meeting with the ethics committee, she said. Some kind of routine review. Nothing to worry about, but I could see the worry in her eyes, the fear. Another week passed. Dr. Chen's name disappeared from the hospital website. Diana pretended not to notice when I mentioned it casually over dinner. Maybe they haven't updated the site, she said, not meeting my eyes. I nodded, took another bite of food, said nothing more. Then came the letter from our bank. Irregularities had been noted in recent transactions. The transfers Diana had initiated were being reviewed, accounts temporarily frozen, pending investigation. Diana didn't know I'd seen the letter. She hid it in her desk drawer, but her behavior changed. More phone calls from the bathroom, more whispered conversations. I still said nothing. Just watched as their plan began to disintegrate, piece by piece. The hospital ethics committee didn't just review Dr. Chen's behavior. They had access to everything. Security footage, communication logs, timing of visits, patterns of behavior that extended beyond normal professional interactions. They found text messages between Dr. Chen and Diana going back months before my surgery, plans, contingencies, discussions about my prognosis that no doctor should have been sharing with anyone, not even my wife. Procedure has 40% survival rate. He had texted her 2 weeks before the surgery. With his condition, likely less. How soon after can we move? She had replied. Give it 30 days to avoid suspicion. All of it logged. All of it preserved by systems they never considered. Dr. Chen was suspended pending investigation. His medical license placed under review. Diana didn't know, not at first, but she found out when she tried to call him at his office and got his administrative assistant instead. The assistant was cold, formal, said Dr. Chen was unavailable indefinitely and couldn't take calls. The next day, 2 federal agents showed up at our door, Economic Crimes Division. They wanted to speak with Diana. I let them in, offered them coffee, excused myself to another room. They spoke for 2 hours. I heard Diana's voice rising occasionally, denials, explanations, excuses. When they left, she was pale, shaking. It's a misunderstanding, she told me, about some financial transactions. Nothing for you to worry about. I nodded. I'm sure it will all work out, I said. That night, she packed a small bag, said she needed to visit her sister in Phoenix for a few days, clear her head. I didn't tell her I knew she didn't have a sister in Phoenix, or anywhere else. Diana was an only child. Take care of yourself, was all I said. She hesitated at the door, almost like she wanted to confess, to explain, to ask for forgiveness, but she didn't. She just left. 3 days later, Dr. Chen was formally charged with ethics violations, insurance fraud, and conspiracy. His face was on the local news. The story spread quickly in medical circles. His reputation destroyed, his career over. Diana never came back from Phoenix. The federal investigation expanded to include her, charges of wire fraud, attempted theft, conspiracy. I filed for divorce, uncontested. She signed the papers without argument, and I never confronted her, never asked why, never gave her the satisfaction of seeing my pain, my betrayal. I let the system, the same dispassionate, logistical system that had caught them, do all the work for me. Today, I live in a small cabin in Colorado. Mountains outside my window, clean air that's good for my recovering heart, the silence of pine forests instead of Chicago traffic. My health improves daily. I walk 3 miles every morning. The scars on my chest are fading. Dr. Chen lost his medical license. Last I heard, he was fighting criminal charges, burning through his savings on legal fees. Diana pleaded guilty to lesser charges in exchange for testimony against him, received probation, moved to Florida to live with a cousin, works as a receptionist at a dental office now. Sometimes I think about contacting her, asking the question that still haunts me. Was any of it real? 12 years of marriage, was it all a long con? Or did she just see an opportunity and take it? But I never make the call, never send the email. Some questions don't have satisfying answers. My lawyers handle everything now. The money has been recovered. My life has been rebuilt, different but stable, and I've learned something through all of this. Some surgeries save more than the heart. They show you who's really by your side and who's just waiting for you to stop breathing.